Hello everyone, welcome to US Residency Training and Beyond. I am Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Oxnard Health in New Orleans. In this video, we will continue with our topic admission. So in the last video, I discussed about admission orders where you might be getting patients from for admission to your service under your attending physician as a resident. Now, once you put in admission orders at the same time, you have to do something called medication reconciliation. So, if there is a patient who is actually coming from within the hospital from a different department, you might already have some information in the patient's chart about what medications the patient is currently getting. So, you will have an idea what medications you have to enter for this patient as a part of your admission into your service. But there are situations sometimes the other department may not have reconciled everything properly, because sometimes the patient might be taking certain medications at home that they have not accounted for. Sometimes they don't know, the patient doesn't know what medications they are taking at home, why they are taking at home. Do they need to continue take, because some of these patients, they don't go see the doctors for a long time. They keep taking medications for the reasons they don't know. So it's important you talk to the patient. If the patient is unable to explain things to you, then talk to the family member to see, ask the patient or the family to bring this patient pill bottles or medications from home, so you can actually see what they're taking at home on a day-to-day basis. And then you can make a decision whether the patient need to be on this medication at all, or you can slowly stop the medication or take further medication or continue the medication. At the same time, if they're coming from the other department, they might have made some changes in the last minute to the patient medications. You might have to talk to the other department resident, fellow, or an attending to find out what should we do with this medication. Do we need to change the dosing, or do we need to stop this medication or taper this medication or change it to some other medication? So you have to kind of have a plan about why you are treating this patient. What's the treatment plan? Does this patient need to be on this medication? What dosing, what timing, how many days, how long? Especially when it comes to like antibiotics, sometimes they start the patient on IV antibiotics and then progress to oral antibiotics. But we need to have a clear understanding of like what's the reason for this treatment, how long should be, what's the dosage, what's the duration, are there any side effects with other medication or other conditions the patient might have. For example, if the patient has a brain bleed and the patient is on aspirin, Plavix or Lovinox or anticoagulation, antiplatelets, you need to be very careful about the patient condition and the medication or interactions with other medications, especially with this kind of high risk medication. So but when the patient is coming from outside a hospital, they're not within your hospital, they're coming from an entirely different hospital. So you need to rely on the medication or the paperwork they're coming with. That's why it's important you actually look at the discharge papers, transfer orders, discharge medication orders, to make sure that you are entering the right medications, right diagnosis, and then right dosages, durations, all those things. If you have any question, do not hesitate to pick up the phone, call the other hospital, talk to the nurse, supervisor, and try to figure out why this patient is on this medication. Do you need to continue this medication? What's the dosing? What's the duration? All those things. Because sometimes if you don't reconcile, if you don't take time to actually understand your medication and medications at the time of admission, you have to do it later on, like maybe like a day 2 or day 3, but you can't hold or give medications that are necessary or unnecessary. So it's very important that you pay close attention, know about your patient thoroughly, review their previous charts, previous medical records, or review their home medications thoroughly, or talk to the patient, talk to the family member thoroughly, in order to understand why we are giving certain medication, what's the related diagnosis, does the patient need to be on this medication. Because what happens is in an inpatient setting, especially with neuro patients like strokes, brain injuries, so the less is the better. We try to give too many medications here, so try to reconcile them and try to avoid any unnecessary medications, or any medication that not needed at all. Okay. and try to explain to the patient. Now, say you've been on this medication for a long time, you don't need to be on this medication, or you don't have to take this much dosing. It was started a long time ago by some other doctor. So that's why it's important to keep that conversation going. And also, now let's in regards to the admission process. So you have entered all the pertinent relevant admission orders for the patient, and you have reconciled all the medications for the patient. So that's how. And then you also did a thorough history physical examination, and then you put in your initial HNP note for the patient. Those are the main things that you have to do on admission. Okay, based on your orders, the nursing and other teams, another they will act on those your orders and do the appropriate things that you need to do with the patient. In regards to any special consultation, for example, if the patient comes to your service but the patient needs dialysis, then you need to put in a special consult, specialty consult with nephrology, so they know that the patient here needs dialysis, so they will put the patient on their schedule, and then they will continue to follow the patient. So if there are any other, like say acute medical conditions, ongoing medical issues, and you think that the patient needs some specialty care, then you should put in a specialty consult, so that particular department knows that they have to see this patient from time to time. Or if something comes up, the patient got already admitted but some acute situation came up, but you think you can still manage the patient on your floor, you don't have to transfer the patient all the way to some other department or ICU or emergency. In that situation, what you can do is you can put in a specialty consult or request with internal medicine or surgery or any other department that you think is relevant for that situation, and then you can continue to keep the patient under your service, under your attending service. You don't necessarily have to transfer the patient if the patient doesn't need to be transferred. Okay, so that's how you manage the patient on the floor. So far we discussed about doing daily rounds, writing your progress notes, doing consults, then admitting patients, and then admission orders, medication reconciliation, initial HNP. Now we will discuss about the discharge. Say if the patient stayed with you or under your attending service for almost a week, and then you decided now the patient is ready to go home, right? In that situation, you have to do an discharge process. The discharge process again is just like admission process. It's very elaborate. So you have to put in discharge orders for the patient. So the discharge medication, same thing. So you have to go over all the active medications that the patient is getting for the past 1 week, and decide which ones you want to continue when the patient leaves, which one you want to decrease the dose or change medication or change in the duration. So you have to be very specific about all those things. And then usually, because now with electronic medical records, you can actually directly send all the medications to the pharmacy from your computer. But in certain situations, because if you don't have that kind of e-prescribing option, then what you can do is you can print the prescriptions or handwrite prescriptions. As a resident, you will be given a prescription pad. You can either handwrite the prescription or you can print the prescriptions and give it to the patient, so that when they go home, they pick up those medications. Because in certain situations, the patient might be in the hospital system for a long time, like a month or two. So when they go home, they may not have all the medications, and also they may not have ready access to the primary care, because they need to make an appointment and they wait for the appointment. So it's important the patient goes home with important medications that they need to continue to take until they see the primary care doctor or like an outpatient clinic. So it's important that the patient knows what medication they need to take, what dosing, what timings, and where they need to. Sometimes you have to ask the patient, most of the times, every time, you have to ask the patient like what pharmacy they usually go to, right? So that you can send the prescriptions to that pharmacy. Or if you're handing over the prescription, they can simply take those prescriptions to the respective pharmacies and then fill those medications and continue to take those medications. That's regards to the discharge medication process. But then there are several other orders. For example, if the patient needs like a diet order, specialty diet, or like a tube feeding, you have to enter those orders as well. So it's important that you do this discharge. So we'll continue with this topic in the next video. I hope you all enjoy my videos, and I will see you all again soon. Thank you.